The Trump administration last night launching its new website known as Trump RX, designed to make prescription drugs cheaper.
Dozens of the most commonly used prescription drugs will be available at dramatic discounts for all consumers.
Long sigh, long sigh. So
Long sigh.
long sigh, right? Millions of Americans ration their medications because they simply can't afford them. Now, the Trump administration says it has a fix, a new website called Trump RX. But is this real relief or is it just a rebrand? I'm Dr. Ida Brown.
And I am Dr. Sonia Sloan.
And we are AYA,
Black and Brown Women Disruptors in Healthcare and Beyond. So Trump described this new initiative as the most transformative efforts in healthcare ever, right? Positioning his platform as a step towards improving drug affordability and transparency for consumers without insurance or if you are a cash payer. But with the launch of the Trump RX website, some experts say it's more of a flash, not necessarily function. So Trump administration has pitched this whole historic step, right? Lowering prescription drug costs for Americans that are already struggling under the soaring medication prices. So as someone in medicine, Dr. Brown and myself, and someone that understands the downstream effect of the sticker shock for real patients. So we're going to sort of peel this back, peel it back, PILL versus P. You get what I'm going anyway. So the rhetoric of the Trump RX website and what it actually means. So first, the Trump RX dispense medications, no drugs. It doesn't do pharmacy benefit management, and it doesn't replace insurance. So it's a federal price comparison and access portal. That's it. It connects the user to the medications, offering through participating manufacturers or pharmacy networks, which means if you've got insurance, you're already getting probably a lower price with most of these medications. But through the plan that Trump RX is suggesting, the insurers and pharmacy benefit managers are negotiating deeply how to get these numbers down. So let's be honest, the platform most likely affects just cash pay patients or uninsured, which usually either you're cash pay, then what's the point? Or if you're uninsured, you probably still can't afford it, right? So that's very, very important. The second point is the coverage is very limited. Trump launched this Trump RX website with 43 drugs, you guys, only 43. So some of those drugs were already widely available at lower costs through traditional pharmacies or discount programs like GoodRx or Cost Plus drugs. Like example, Protonix is a reflux medication for ulcers and whatnot. Under the basic cost, $10, low cost outlets, most of them. Under Trump's RX listing at $200. What? That's not a savings. That's confusion plus overpayment. So then thirdly, the site has no, let's just say the transparency is under scrutiny right now. Many of the prices are touted on the portal don't reflect the total cost. There's hidden pharmacy markups, also insurance copays. So some discounts you're better off than just off-site alternatives that patients could already get to anyway before the Trump RX. So according to Guardian, though, health economics basically say that the site is just complicating things that are already complex. The drug pricing system in America needs to be simplified. They're just making it worse. So doctors know this. We need not another landing page. We need real systemic reform on how the United States negotiates the prices, how rebates and insurance formularies work, and how to hold pharmaceutical companies and marketing accountable. Let's roll this next clip.
The website does not sell medications directly. Instead, it offers pharmacy coupons like this or discounts through the manufacturer. The president saying consumers can expect big savings on medications used to treat diabetes, heart disease, and obesity.
Cheaper, Dr. Brown.
Cheaper, right?
Mm-hmm.
So, and the experts agree. A health economics and policy professor, as well as the former dean of pharmacy, Sean Sullivan, who's at the University of Washington, he said it plainly. Trump RX is not a solution for high drug prices in the United States. Because here's what a website cannot fix. It can't fix insurance gaps. And those gaps have been widening, and they've been accelerated by the expired ACA subsidies and subsequent administration rollbacks on healthcare access. So let's talk about the two categories the White House is spotlighting. One is weight loss drugs, and the second is fertility medications. And that's because those numbers definitely deserve a closer look. So first, on your GLP-1s, Wegovy is now listed on Trump RX at $149 a month. Now that's great, right? It's down from $1,349. That's very dramatic, sounds incredibly dramatic. But here's what they're not telling you. That price has already been dropping. It was voluntarily reduced to $499 back in March 2025. And then in November, it went to $199. And that's all through negotiations with the federal government. And this is all before Trump RX. So the website's taking credit for a trend that already was in motion. And most insurance plans still won't cover GLP-1s adequately. And so for these patients that need the most, they're really still out of reach. All right, so now the second one, fertility medications on Trump RX. Gonal is decreased by 83%, Cetrotide by 93%, and Avidril by 67%. So those are great reductions. And, you know, Dr. Oz said at the podium, the Dr. Oz, he was talking about IVF access for families that can't conceive. And, you know, I really think that we should all ask ourselves why fertility is suddenly front and center. Reproductive rights have been stripped. Abortion access is gone. And now Trump RX wants to take credit for making it easier to conceive. It's polyfactorial, right? So I'm just saying the audacity is clinical because drug costs are only one part of why fertility treatment and fertility care is so expensive. It costs tens of thousands of dollars out of pocket. And so discounting one medication doesn't necessarily make IVF accessible, right? That's like discounting anesthesia and calling surgery affordable. It's still expensive. So one more thing. Doesn't this model already exist? Guess what? It does. So pharmacist Christina Madison told ABC News that Trump RX looks nearly identical. Want me to say it again? Nearly identical to existing drug programs like GoodRx. And you've seen those little GoodRx cards all over the place, right? GoodRx confirmed that it is the integration partner. So GoodRx is hosting the self-pay prices and linking them directly to Trump RX. So GoodRx is already accepted at over 70,000 pharmacies nationwide. And what we really have is this repackaged system with a presidential signature on the label. Let's roll the next clip.
But notably, a lot of these drugs are older and there are generic alternatives for these medications. The pharmaceutical companies that are participating were not looking to give discounts on their bestsellers, their newest drugs. So in many cases, these are drugs where there might have already been discounts available. And if you go on the website and look, there is a warning even. If you have insurance, you might be able to get a discount that is better than what is available through Trump RX.
I love the language. He said there's a warning. You know, it wasn't like just information, as a warning. So as they've launched this TrumpRx.gov, the federal drug pricing website, the U.S. government listed, again, 5 pharmaceutical manufacturers who jumped at the bit. It's right off the top. So you have number 1 is AstraZeneca. Number 2 is Eli Lilly. Number 3 is EDM Cerno, prior known as Merck, the KGA unit, Novo Nordisk, and Pfizer. So, however, Trump's website with these 43 drugs, more than half of those were already available in generic form at a significantly lower cost. So what does that mean? Prescription drugs in the United States are not controlled by one person, not by one agency, and definitely not by one website. It's a layered system, if you will. So you have Congress, the Department of Health and Human Services, the Centers of Health, Medicare and Medicaid Services, the FDA, private insurers, pharmacy benefit managers, as well as pharmaceutical manufacturers. It is huge. So the single executive branded platform itself, as a mechanism for altering drug pricing is a farce, and it raises a lot of structural questions. Number one, what statutory authority is supporting this? Number two, is it operating under existing federal law, or are they skirting the traditional legislative process, likely? Or the other question is, who's overseeing this whole thing, right? So under the Constitution, Congress writes the law regarding commerce and regulating the commerce including pharmaceutical sales. The executive branch just enforces the laws, right? So someone's overstepping their bounds. So major drug pricing reforms, including Medicare's negotiation authority under the Inflation Regulation or Reduction Act, required congressional legislation. So the issue here isn't just pricing, it's a balance of power. And we already know that with this administration. If they want the administration to have direct to public platform for reshaping pricing authority without a clear legislative backing, that shifts the practical power towards the executive branch. Sounds familiar, right? With everything else that's going on in the United States. That doesn't automatically make it unlawful, don't get me wrong, but it does raise the question of separation of powers. The concern should be overwhelming to all of us. The system was designed so that no single branch controls economic regulation. Now, let's consider this from the pharmaceutical standpoint, right? Their industry, drug manufacturers have historically resisted direct government negotiation beyond Medicare's defined authority. And I'm sure that's because they were making money, right? But this argument is consistent with government price setting because what we should be concerned about, it reduces research and development investment. It reduces the innovation that develops and depends on profit margins, and also the price caps that are now may likely be more limited and unavailable. So industry groups like pharma have previously challenged the expanded federal negotiation in courts. And so that platform that centralizes executive influence over price sends three strong signals to manufacturers. One, expand federal leverage. Two, increase public pressure. And then three, reduce price autonomy. And that's where the real debate really begins, Dr. Brown.
So listen, right? Markets don't just react to policy. They react to the perception of policy change. And as a surgeon who served as a service chief in a major New York City safety net hospital, we were serving historically underserved communities with chronically limited resources. I know what it means when the system performs reform instead of doing it. Listen, a website is not a scalpel. You can brand a portal. You cannot brand structural change. Real reform requires what any good surgery requires, right? The right authority, the right tools, a clear plan, statutory authority, enforcement mechanisms, negotiation contracts, regulatory rulemaking, and that's the anatomy of actual change. But when policy gets personalized, branded to a person rather than anchored in law, we, the people, we trade institutional continuity for personality-driven governance. Healthcare systems don't heal well from instability. So what should you actually look for? Is Congress formally informed? Are CMS and HHS issuing regulatory guidance? Are pharma companies lawyering up? Those signals tell you whether this is an operational change or just political theater, because in medicine, just as in policy, execution matters more than your headlines. And when it comes to what this actually means for the patient in front of you, Dr. Sloan, can you just get clinical and break it down for our audience?
Yeah, let's take it home. Let's bring it here. When a small group of cash paying patients, are they going to be seeing the savings that Trump RX is offering? Possibly. Will this fundamentally eliminate the high drug costs in America, especially for those with insurance? No, by no means. Even The Guardian has cited this. Does it replace the need for robust policies such as broad drug price negotiation, mechanisms that are embedded in law and insurance reform? Absolutely not. That is not what this is. So in plain clinical terms, making the medication cheaper does not make the treatment accessible. So when insurance design and catastrophic care costs still will leave families in financial jeopardy, we have to ask why Trump RX is now launching. Dr. Brown?
Listen, as a surgeon, right, I trained at one of the best orthopedic hospitals in the world, right? And one thing that got drilled into every single one of us, and actually probably every single trainee in the country, is that precision matters. Measure twice, cut once.
Yep.
You can ask any surgeon anywhere, that phrase is always said in the OR, and it never really leaves the OR. Because in surgery, imprecision has consequences. And it's the same with policy. Trump RX is not precision. There was no measuring here, guys. This was a cut that was made for cameras. And, to have the audacity to name a federal health initiative Trump RX, are we sure this isn't going to go to the way of Trump Steaks or Trump University or the Trump modeling management? I mean, because the pattern's familiar. Big launch, bold branding, and then what happens? Where do they go? And who suffers? Our patients. They deserve real, durable, structurally sound policy. Not a portal, not a press release, not a legacy play. And we said what we said. Dr.
Exactly.
Brown, take us home.
This is like when it looks like a duck and quack like a duck. I'm just saying. Healthcare affordability isn't a website, you guys. Real change means structural fixes, not portals that are repackaging discounts that already exist. So stay informed. We want you to ask the structural questions, follow the legal framework, not just the branding of your president of the United States. We're Aya, contributors to MeidasTouch Network and proud members of the Meidas Mighty. Please subscribe, like, share, and follow for more updates. Have a great week.
Bye, everyone.
Want to stay plugged in? Become a subscriber to our Substack at MeidasPlus.com. You'll get daily recaps from Ron Filipkowski, ad-free episodes of our podcast, and more exclusive content only available at MeidasPlus.com.